The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon. On behalf of the Academy of Doctors of Audiology, I'd like to welcome you to today's webinar, the PPOD and Others Tool Guide, Interprofessional Education in Collaboration with Pharmacy, Podiatry, Optometry, Dentistry, and Audiology. My name is Cody Jones, and I'm pleased to serve as today's course moderator. This webinar will cover the guide, Working Together to Manage Diabetes, a guide for pharmacy, podiatry, optometry, and dentistry, to show how practitioners in the four disciplines presented here, pharmacy, podiatry, optometry, and dentistry, can work collaboratively with each other, as well as all other members of the healthcare team, such as audiologists, primary healthcare providers, physician assistants, nurse educators, and community health workers, to treat people with diabetes. There are just a few housekeeping items before we begin. 1. Please type your questions into the question queue and we will address them at the end of the presentation. 2. Immediately following today's session, you will receive an email containing all the information needed to apply for continuing education credit through the American Academy of Audiology. All attendees will receive a general certificate within 30 days of this course. And 3rd, the slides from today's presentation will be distributed in the post-webinar email. Today's presentation is also being recorded and will be available for download next week. Lastly, it appears we're having technical difficulties with the captioning service. Please check back into the ADA website within a week and we should have something available with the transcription. At this time, it is my pleasure to introduce today's course leaders, Drs. Pamela Allweiss and Kathy Dowd. Dr. Allweiss is an endocrinologist with the CDC Division of Diabetes Translation. She completed her fellowship in endocrinology at Cedars-Sinai Medical Center in Los Angeles and was a chief clinical fellow at the Joslin Clinic in Boston. She received a Master of Science in Public Health while completing a residency in Preventative Medicine and Occupational Health at the University of Kentucky. She has been in private practice and on the faculty of the University of Kentucky Medical School. She has been working with the CDC Division of Diabetes Translation since 1999, working on several projects that include the National Diabetes Education Program Worksite Initiatives, the Pharmacy, Podiatry, Optometry, and Dentistry Initiatives, the CDC National Healthy Worksite Program, and CDC's Emergency Preparedness Programs. She is also the co-chair of the American College of Occupational Environmental Medicine Health and Productivity Section. Dr. Kathy Dowd received her undergraduate degree in French education from Spalding University, her master's in audiology from the University of Louisville, and clinical doctorate from Salus University. Her background in audiology over the past 39 years is varied: educational audiology at local and state levels, as well as private practice in ENT and proprietary clinics. For the past 5 years, Dr. Dowd has worked to raise the awareness of chronic disease and ototoxic medications causing hearing loss by instructing diabetes educators, optometrists, and audiologists nationally about the silent, unmet medical need. In April 2016, her advocacy efforts moved the Centers for Disease Control to consider a recommendation for hearing testing to the patient guide. Take charge of your diabetes. Dr. Dowd is heading the advocacy and collaboration of audiology organizations and setting clinical guidelines for patient care in the area of chronic infectious diseases. Please welcome Drs. Allweiss and Dowd.
Well, thank you very much. This is Pam Allweiss. I'm going to start out and then Dr. Dowd will continue. I'm very glad to be here and I'm going to give you some history on why we're here and where we're going. Next slide, please. So first of all, I want to ask, what is a PPOD? And it turns out, yes, it's a vegetable, but it's also a work group that was formed many years ago when the National Diabetes Education Program was formed. NDEP is a joint program with NIH and CDC, and it was formed after we received the results of a study that showed that better control of diabetes definitely led to fewer complications. Excuse me. So when NDP started, we started getting all types of work groups: healthcare providers, consumers, people who were old, people who were young. And our initial providers included the traditional folks, the physicians, the diabetes nurse educators, and the nutritionists. But then we realized that there were a number of providers who often would be the first ones to see a person with diabetes. So we started out with pharmacists, podiatrists, optometrists, and dentists, And that's how we ended up having the PPOD work group. And we started talking how these providers could work together, how they could have the same messages, etc. And now we're ready to expand it to other providers. So I'm going to give you a background on what type of resources we have and how team care is so important. Next slide, please. As I said, a PPOD provider may be the first person to see a person having a new problem. Often people will come into a pharmacy, for instance. They may be filling medication for diabetes, and sometimes they're not even sure that they have, quote, real diabetes. They said, oh, no, I was told I was borderline or something like that. Or a person will see a dentist and will have severe periodontal disease and may not even know that he or she has diabetes. Often people are not diagnosed for many years, like 7 to 10 years before they have diabetes, especially type 2. So a PPOD provider, and of course others, may be the first person, and it's important to keep it on the radar screen so that good communication among all the providers is important. Diabetes is a systemic disease, and it can affect almost every organ in the body. So that's why it's important for all the people who take care of all the different parts of the body to kind of coordinate so that the care for a person with diabetes is uniform and we spread the word. Next slide, please. So PPOD providers can recognize signs and symptoms of diabetes, reinforce the importance of annual screenings and healthy habits, okay? So that, let's say a dental professional will see somebody with diabetes and say, okay, this is great, you have your dental checkup. Hey, when was your last eye doctor appointment, or did you get your flu shot, or something like that? And just in the course of conversation, reinforce. We always say that somebody needs to hear something 3 times before they're going to change their behavior. So if they hear it from all different sectors and all different folks, perhaps their behavior will change. Of course, PPOD providers will provide treatment. We can encourage teaching so that people can self-manage their disease, and give consistent messages, recognize early danger signs, etc., and promote the team approach. It's very important that the pharmacists know the medication, and that the dentists know, and that the dentists and all the other providers work with the primary care folks, such as the physicians, nurse practitioners, and the PAs. Next slide. So we have a key message. Control the ABCs. A is A1C, blood glucose control. A1C goes back 2 to 3 months. Blood glucose attaches to the red blood cells, and a red blood cell usually lasts about 90 to 120 days. So there's a normal percentage, and we can see if it's elevated what the average blood glucose would be going back about 3 months. Blood pressure control is very important. Cholesterol, blood lipid control is important. And of course, no smoking, no use of tobacco products whatsoever, because smoking can increase the small blood vessel, the microvascular disease, and the macrovascular, the large blood vessel disease in anybody, and especially in people with diabetes. So we want people to control their ABCs, and all the providers can give this message. Next slide, please. There are definitely benefits to patients, because if we give a patient a consistent message, as I said, they're more likely to change their behavior. And consistency is very, very important. And the preventive care. The other thing is, as we educate more and more providers, we increase the awareness of some of the other complications. Most people know about eyes and kidneys and perhaps feet when it comes to diabetes complications. But we're finding more and more that people forget about the oral complications of diabetes, and we're finding more and more that definitely there's hearing loss associated with diabetes, but it's, people just don't know about it, and we have to increase the awareness for everybody to test, and Kathy will talk more about why it's so important. Next slide. So what the National Diabetes Education Program did, we developed some materials for providers and for consumers. And we have something called Working Together to Manage Diabetes, and it's a monograph. Currently, we have the pharmacy, podiatry, optometry, and diabetes and dentistry, but certainly we're open to including more providers. And Kathy and her group they're working on resources for both providers and for patients to educate folks about the role that diabetes plays in hearing loss. But this monograph has a chapter written by a podiatrist, but not for a podiatrist. It's written for other providers. It's a cross-education resource. It's what the dentist wants the podiatrist and the pharmacist to know about oral health in people with diabetes. We are not trying to make pharmacists into podiatrists, but it's very important that people have a basic understanding of some of these complications, because then they can work together. So in this monograph, we talk about the current data and trends. We talk about common diabetes-related complications, assessment techniques, key warning signs, and then I'll talk about the patient education information later. Next slide, please. So as I said, it's a quick course on each specialty. If a dentist would read the chapter on dentistry or oral health, the oral health professional might think it's a little simplistic. But as I said, it's what they want other providers to know as the basic information to help patients as well. So that, as I said, the goal is to relay consistent messages across the disciplines. Next slide, please. So we have specialty sections, as I said, what PPOD specialists want others to know. So we're going to go through just to give you an example of how this information is portrayed and some action steps what providers can do. Next slide. So I'm going to just give you an overview of some of the diabetes complications just to set the scene. The rate of periodontal disease is 2 to 3 times higher in adults with diabetes. And often primary care providers will say, it's just a cavity. But if we would take an abscess in a tooth and almost superimpose it on a foot, it would be huge and people would notice. So it's a complication that people forget about. But it's very common, and as I said, it's 2 to 3 times higher in adults with diabetes. Another complication when we talk about foot infections. So many people with diabetes have nerve damage or neuropathy, and they cannot feel. Their balance sometimes is off. Their position sense is off. They sometimes might step on something and not feel it. So that certainly can set up an infection. That's another complication of diabetes. And of course, diabetes is the leading cause of new cases of blindness among adults ages 20 to 74. So we have our work cut out for each other, and looking at each of the specialties and trying to improve outcomes is really important. Next slide. So we're going to start with pharmacists, okay? Medication therapy, management, and diabetes. More than 50% of people with chronic disorders don't take their medication properly. And certainly people with diabetes have many comorbidities. They may take a medicine, 1 or 2 or 3 medicines for their diabetes, for their blood pressure, for their hyperlipidemia, or whatever. And it can get very, very confusing. Many people with diabetes don't have their blood glucose in the goal range, so they may need to take different medications or more than one medication. So it's very difficult sometimes to keep everything straight, and a pharmacist can help. Next slide. Now, we also have medication related complications. Sometimes people are allergic to a medicine, or there are interactions with medications, or people are taking over-the-counter medicines that they don't realize might be harmful. The pharmacist may be the first person who can certainly look at if there are any interactions. And when sometimes a person will fill something and come back to the pharmacist and say, oh, it didn't agree with me or whatever, the pharmacist may be the first person to know that there's a problem with a new or existing medication. Next slide. So the role of the pharmacist, there was some information. A patient will see their pharmacist 7 times more often than their doctor. And that makes sense, because if people only get, let's say, a 30-day or 60-day supply, and they're back at that pharmacy, unless they have mail order, if it's every 2 months, they're back there 6 times a year, whereas they may only see their primary care person 3 or 4 times a year. So it's a perfect opportunity for education. A pharmacist can also do some other services like immunization. Okay, more and more pharmacies are offering and training their pharmacists on how to give immunizations. And for everybody, it's important, and especially for people with diabetes. Pharmacists have longer hours. There are more locations where people can go. So pharmacists play a very big role in helping people with diabetes control their condition. Next slide. Pharmacists can monitor the drug regimens. They can provide other education to control diabetes. Many pharmacists are certified diabetes educators, and they can communicate with the healthcare team. They also can play a role sometimes if people cannot get some of their medication because of cost, and may be able to work with their primary care doctor to suggest maybe a different medication that might be covered on the plan. Next slide. So these are some of the questions that pharmacists would like providers to ask their patients with diabetes. Do you have a list of all of your medicines, vitamins, and supplements, including over-the-counter, including herbal medicines, etc.? Do you know the reason why you take each medicine? And have you reported any side effects from your medicine to your pharmacist or to your doctor? If the patients can't answer this, it's time for more education, and the pharmacist can help do this. So even if it's a different provider asking the question, the person can be referred back to the pharmacist to educate them about their medications, the side effects, etc. Next slide. So this is an example of how team care can work, okay? A 40-year-old woman notes blurry vision and asks her pharmacist about reading glasses. I mean, you know, pharmacies are one-stop shops now, okay? The pharmacist discovers that the person was diagnosed with diabetes just last year, but she didn't return for her follow-up appointment. And certainly blurred vision can be a sign of diabetes, and she may or may not need the reading glasses. As I said, we're not saying the pharmacist should be optometrist, but it's to get it on the radar screen. Encourage that person, go back to your primary care doctor. You may need to see an optometrist or an eye doctor for your vision. And also the pharmacist can get materials for the person we'll talk about in a little bit about healthy eyes, etc. This isn't one example of how a pharmacist can be part of the team and may call the primary care or may call the optometrist or whatever. Next slide. Podiatry, foot health and diabetes. Okay, more than 60% of non-traumatic lower limb amputations occur in people with diabetes. People with diabetes are 15 to 26 times more likely to have an amputation than patients without diabetes, for many reasons. They have nerve damage, so they can't feel. They also have vascular disease, so the perfusion to their extremities is decreased, etc. And people need to be educated about routine foot care. And often early in the game, it's very treatable. But we have to educate people on how to take care of their feet. Next slide. Foot exams are very, very important. And we put up signs in the office. If you have diabetes, please take off your shoes and socks. Okay, because if somebody comes in now, when I was in practice, even my patients with thyroid disease would take off their shoes and socks. But so that's fine. But everybody with diabetes should take off their shoes and socks. Okay, if people are at higher risk for having a foot infection. And those at higher risk might include folks who do have neuropathy, who have poor peripheral circulation, even people who smoke, because smokers definitely have decreased circulation to their extremities, okay? Very important to educate. It is important for everybody and to show people, even at low risk, how they can prevent, okay? Don't go barefoot. We don't like people to even soak their feet for long periods of time. Feel the bath water before you put your feet in. These are very simple things that people can do to prevent a foot infection from becoming worse. Next slide. So what podiatrists would like other folks who take care of people with diabetes to ask, do you get a full foot exam by a podiatrist at least once a year? And that's not just looking. That's checking to see if they can feel pain, if their vibratory sense is intact, because that's one of the first things to go to see about their balance. Ask them, do you know how diabetes can affect your feet? And do you check your feet every single day? Simple questions, but at least it puts it on the radar screen, and we try to avoid problems or fix problems when they're early. Next slide. So another example, how PPOD in action, how podiatrists can play a role. A 70-year-old man consults a podiatrist because of corns on his feet, and it's really hard to walk. Well, on the other hand, this person with diabetes is getting the message, hey, physical activity is really important to help control your diabetes, and if you're at high risk for diabetes, to prevent type 2 diabetes as well. The podiatrist may share some information about how diabetes can affect the feet, etc. Another example is, let's say, an optometrist or a dentist will see a person with diabetes coming into their office in house slippers. Well, this is a perfect opportunity to say, hey, what's going on? Where are you in house slippers? And they may see swelling, they may see sores, or whatever. So it's on the radar screen. Just think about it and know, and then refer or do something about it. Next slide. Eye health, another thing, very important. Certainly, we have optometrists and ophthalmologists, and both are very good at both diagnosing and treating. Certainly, ophthalmologists may do other things than optometrists, but for diagnosing and screening, very, very important. 11% of U.S. adults with diabetes have a form of visual impairment. Now, this can be all the way from blurry vision. It can be anything from cataracts to retinopathy, when the blood vessels behind the eye are damaged. And adults with visual function loss are at least 90% more likely to have depression as well. And this is important because people with hearing loss also have depression. People with diabetes in general also have depression. So if people are depressed, often they won't take their medications correctly, etc. So all of these things contribute to the total person with diabetes. Next slide. Eye exams, very important, a dilated retinal exam. Now, some people are also using some machines, these non-mydriatic cameras that can be very, very helpful as a screening mechanism. And we want to educate folks on how to get their eyes checked early to prevent further problems, because things are very treatable in the early stages. Next slide. So questions to ask a person. Do you get a full eye exam with dilated pupils at least once a year? Now, it depends. If people already have complications, it'll be more often, but this is a baseline. Do you know how diabetes can affect your eyes? And do you know what to do if you have vision changes? So if people have a field of vision cut, or they see floaters or whatever, we want them to know that they need to call their eye doctor right away. Next slide. So an example, 45-year-old African-American brings her mother for her annual comprehensive eye exam. Now, the eye care provider asks if this person has ever considered that she too is at risk for developing type 2 diabetes, because family history is a huge, huge risk factor. So it's in the conversation and it's on people's radar screen. Okay? The provider can educate and give a person some of these materials. Am I at risk from the National Diabetes Education Program? And the provider might say, okay, make up a follow-up appointment. This is how every member of the team can help people with diabetes or people who are at risk. Next slide. The last from PPOD is oral health. As I said before, it's one of the complications that is least recognized, and it's very important because it's a two-way street. Uncontrolled diabetes will contribute to poor dentition, inflammation, and inflammation will contribute to poorly controlled diabetes. Blood glucoses will go up. So it's definitely a two-way street. One study showed that 85% of people with type 2 diabetes report they have no information about the association between diabetes and oral health. And also providers, as I said before, oh, it's just a cavity. And we're finding out more and more that there's this oral health and systemic body connection with inflammation, possible heart disease, etc. We also know that tobacco will increase complications such as retinopathy, nephropathy, but we also know that tobacco use are also risk factors for compromised oral health. So all of these things play a role. Next slide. Oral health exams are really important. People need it at least once a year, sometimes twice. It just depends on the person. Educate people that there is a link between diabetes and oral health. We want people to know that, like, for instance, thrush may be a sign of diabetes. Sometimes people don't know that. And if people have some early inflammation, we want to prevent it from becoming more. Next slide. So key questions to ask your patients. Do you visit your dental provider at least once a year? Do you know how diabetes can affect your teeth and gums? And most often the answer is, I didn't know that. And do you know the early signs of tooth, mouth, or gum problems? Are the teeth loose? Do they have some inflammation? Do they have thrush? Do they have bleeding gums? Do they have bad breath? Some very simple questions that can increase the awareness. Next slide. So an example, a dental patient is scheduled for a procedure, but she doesn't understand how to manage the timing of her insulin injection. Now, this should be a more in-depth procedure. It wouldn't just be a teeth cleaning or whatever. It probably would be more like oral surgery. But if a person is told not to eat and they take insulin, it's important that the person know how to adjust it. So the dentist will call the pharmacist or the primary care person, and they'll develop a regimen for this person to take the recommended dose of insulin, maybe half before they eat, depends what time the treatment is scheduled, etc. But the point is that interaction and communication among all of the team members is really important. Next slide. So we also developed some resources for consumers. And we have a general fact sheet that says, okay, what do I need to know about oral health, podiatry, optometry, etc. on one side. And on the other side is like a checklist that the person can bring to all of the providers to write things down. We also developed some fact sheets called Healthy Teeth Matter, Healthy Feet Matter, Healthy Eyes Matter, and All Medicines Matter. And everything that CDC develops for consumers has to go through a simple language process so that if people have low literacy, they're able to understand it. Now Kathy is working on Healthy Hearing Matters as well. Next slide. And all of this is in the public domain, and you can download it. Now, when we looked at the multidisciplinary patient care checklist, we pilot tested it with PPOD providers. And they said that it definitely put it on their radar screen about collaborating among all members of the healthcare team. Over 70% said that they were likely to change their practice to a more team approach. They hadn't thought about calling some of these providers, but they realized how important it was. Next slide. So before I turn it over to Kathy, my point is we want folks to practice true multidisciplinary team care. Collaborate with other health providers, including the podiatrists, the pharmacists, the optometrists, and dentists. But don't forget about the primary care physicians, nurse practitioners, community health workers, audiologists, and there are more, certainly physical therapists, all kinds of people who touch a person with diabetes. Network with your local associations. When we did a program about 10 days ago with the National Academies of Practice, all of these people have seen people with diabetes, so it's really important. Consider working with your other PPOD providers, increasing their education about audiology, for instance. And you can use and tailor PPOD materials. Everything that CDC has is in the public domain, so as long as you don't change it, you're welcome to put your logo or whatever on it. Next slide. So now I'm going to turn it over to Beth Dowd. How do we start involving the audiology world? Everything at CDC has to be evidence-based, okay? And certainly there's evidence about diabetes and its relation to hearing loss. So I'm going to turn it over to Kathy right now.
Thank you so much, Dr. Allweiss, and thanks for accepting the invitation to speak today. Your support for audiology and management of hearing loss and risk of falls has been very important. And my presentation today is kind of a melange of the National Academies of Practice presentation that we did 2 weeks ago, and then also your presentation that you did on PPOD at the stakeholders meeting almost 2 years ago. Next slide. So from the National Diabetes Education Program, and this is something that you put together, Pam, the evidence is there for hearing impairment and diabetes, as well as vestibular impairment with diabetes. The NHANES study was a landmark retrospective study on diabetes and hearing impairment and showed that there was a definite connection for adults, as well as this three-decade change in the prevalence of hearing impairment and association with diabetes. Next slide. So the Take Charge of Your Diabetes book is an NDEP book, and from what I understand in discussions with Pam, this is changing. Now there are going to be one-page supplements for comorbid conditions like feet, eyes, pharmacy, skin, etc. Things you need to know if you do have diabetes. What do you need to be concerned about and knowledgeable about? So what do audiologists want other providers to know? Next slide. Obviously, we need for physicians and other medical healthcare professionals to know that hearing loss is twice as common in people with diabetes as it is in those that don't have the disease. You're more likely to have a hearing loss, and it's an under-recognized complication of diabetes. Next slide. And since 2011, I've been out talking with diabetes educators and physicians. I can assure you that even now, if you go out in your community and start taking this message out, you will find that it's under-recognized. But it's going to, if a person with diabetes has a hearing loss, it's going to be more difficult for them to manage their diabetes when they go to diabetes education. Every person who's first diagnosed with diabetes can receive 10 hours, up to 10 hours of diabetes education. This is very important. So are our patients that are coming in for hearing testing knowledgeable about the services from a diabetes educator? And can you link them up with those services? Hearing loss makes depression worse. We know that. But then also, if you have diabetes, you have a potential for depression. Next slide. How are diabetes and hearing loss related? Over time, the high blood sugar levels damage small blood vessels in the body. So it affects every part of your body, your eyes, kidneys, nerves in your feet and hands. And so it's inescapable that it's going to affect the ears and the vestibular system, because hearing depends on the stria vascularis, the small blood vessels in the cochlea, and the eighth nerve to send the signal up to the brain to be understood. And those are affected by the high blood sugar levels. Next slide. Symptoms of hearing loss. What we want other professionals to know is that the family members are probably going to notice that a person has a hearing problem before the person themselves notice it. It's interesting that you say it takes 7 to 10 years for someone to be diagnosed with diabetes, because that's a very similar time frame for someone to be diagnosed with a hearing loss. But if you can get the person with diabetes to answer these questions, do they have to ask people to repeat themselves? Does it sound like people are mumbling? Do they have to turn the TV up or the radio up too loud for others in the room? Now, that's a tricky question because they're turning it up to where it sounds fine. So that's almost a question you need to ask the spouse or family member when they come in with the patient. Do you feel like the TV is too loud? Next slide. So all of these diseases affect hearing and balance: diabetes, chronic renal disease, cardiovascular disease, hypothyroidism, Alzheimer's disease, Paget's disease, Crohn's disease, as well as infectious diseases. We're only concentrating on diabetes right now, but I can assure you these other chronic diseases do not have hearing and balance on their radar for the most part. Next slide. And what exactly happens with hearing loss? The research calls this disruption in the small blood vessels microangiopathy. So it's cochlear microangiopathy, where the small blood vessels actually swell and grow new tendrils, or they swell and burst and they leak blood into the surrounding fluid of the cochlea, as well as neural degeneration on the eighth nerve. When you go on to balance issues for diabetes, obviously the foot neuropathy, not being able to feel their feet and know where they are in space, not having vision or limited vision to know if there's a rise or a step in front of them or a rug that they need to raise their foot above, as well as the vestibular effects of diabetes. In addition to that, there is diabetic pain and there is infection control with diabetes. It's very difficult for someone with diabetes to get rid of infections. And so with knowing that, if someone gets an infection, for example, like Clostridium difficile or C. diff, the doctor more times often than not is going to recommend something that is ototoxic or potentially vestibular toxic. And unless they know to refer for audiological medical management, that person suddenly gets a hearing loss and nobody understands why their hearing has changed. Next slide. So we know the consequences of hearing loss. We know the symptoms. Usually, though, what the doctor sees is confusion, and they may actually associate the confusion with early Alzheimer's, when in fact it's just not being able to hear and being depressed. There's a lot of stress with not being able to hear. How it affects medical management for that patient. If they miss verbal instructions, that leads to non-compliance for those instructions, how they're supposed to follow through on directions from their provider. And then that in turn leads to worse patient outcomes. Again, everyone is looking for the best patient outcomes possible. And so knowing whether the person can hear or not is very important. Next slide. What we know about complications with diabetes is, according to the NHANES study, the prevalence is 30% for hearing loss. Now, diabetic retinopathy in North Carolina, the prevalence is 19.5%. So the NHANES study was done a long time ago, and we're not tracking hearing loss right now, which would be a good thing to have on our radar. When you move into a skilled nursing facility, 80% of the residents have a hearing problem. We test every single baby that's born, and the incidence is 1 to 2%. And we as audiologists know how important that is, to find those children right at the get-go and get them involved in correcting the hearing. And yet, for diabetes, nothing's being done at this point. We're working on that. We're making that grow. Skilled nursing facility residents, everyone on admission should be tested. Vestibular, 39% of persons with diabetes have balance disorders, but obviously their fall risk is going to be higher with diabetic retinopathy and peripheral neuropathy. Cognitive issues with diabetes obviously are going to be comorbid with the auditory and vestibular disorders. So, whether it's disruption in the microangiopathy of the brain or just not being able to hear. Next slide. And this is a slide from Dr. Michael Duenas from the American Optometric Association that he sent me a long time, several years ago. He feels there is a one-on-one correlation between diabetic retinopathy and hearing loss. But you can see from his perspective and from diabetes care, every major system in the body is affected by this microangiopathy, this disruption, this neural degeneration. So we have to be aware of that when we're seeing a patient in our office for a hearing test. If we know that they have diabetes, we need to be asking them questions about, have you been to the dentist recently? Have you had your eyes checked in the last year? What's going on with your feet? Do you see a podiatrist? Or does your physician check your feet once a year? And certain physicians do that as part of a certification process they're involved in. Next slide. So from an audiological standpoint, with the PPOD professions, we need to align with pharmacy for oto and vestibulotoxic monitoring of medications. Pharmacists do know this link, but again, if they don't know you, they don't know who to refer to. Collaborate with podiatry for better balance and foot care. If someone comes into your office, as Dr. Allwise said, be aware of foot care and ask the questions. Ensure that an optometry evaluation has taken place, and that is going to help lower the risk of falls. And counsel your patients to see the dentist several times a year. So it's going to be very important in each of your local areas and state areas to reach out to these professions and to the medical world to educate them about audiological medical management. Next slide. So what should you do if you think you might have a hearing loss? You talk to your doctor? Well, I think first audiologists need to approach the doctors and make sure they understand this link. Because just like back in 2011 when Dr. Allwise and I first spoke, CDC was unaware of this. And I think we've made great strides in making professionals aware, but I think for the most part, we've only moved the needle a little on that spectrum. Definitely, people need to get their hearing checked. Getting help from an audiologist or a doctor who specializes in hearing problems is important. Now, the term for me, hearing specialist, sometimes refers to a hearing instrument specialist who I do not think does audiological medical management. So I think delineating to who the medical professional is very important. But as audiologists, we're going to cover many things about hearing loss, making sure that they protect their ears from loud noises, be mindful of certain medicines, and they may need to come see us more frequently, and then also smoking cessation. Next slide. We can establish public and private partnerships, and I think this is already ongoing. We have 30 state cohorts within the Audiology project. So we have audiologists who have stepped up in 30 states to say, I want to do something to raise awareness and to advocate for audiological medical management of hearing loss and balance issues. We can reach out to these professional organizations, the American Association of Diabetes Educators, and you do have these in your states and in your local areas. The diabetes educators, like I said, I think are kind of a linchpin for diabetes care. The American Diabetes Association, AACE, and other PPOD professional organizations go to consumer groups. And there is a adaptation for the Healthy Eyes Matter. If you go to the next slide. Okay, and thanks to Dr. Tarvin in South Carolina, she was instrumental in taking this on and actually starting with a format for the Healthy Ears Matter handout. So it's a double-sided handout. We spoke with Dr. Allweiss about it. We have sent it to our audiological professional groups to look at and give us feedback. And so it basically is something to educate both the patients and the medical professionals. So it tells why diabetes is harming the ears, what diseases are associated with diabetes, what ear diseases, why should you visit your audiologist, when is it important. Next slide. A to-do list for healthy ears. Get a baseline audiology exam for hearing and balance as soon as you're diagnosed with diabetes. And just as an aside, my husband and I went yesterday for a baseline hearing test. Here I am preaching that to audiologists and to patients, but really it's important to do this ourselves also. The audiologist, once they know your case history, they're going to recommend what the next step is based on what medicines you take, what other chronic diseases you have. They may recommend that you come in a year, but they may recommend that you come back in 3 months based on certain medications that need to be monitored. And then it's important to contact the audiologist, as well as for them to be aware of the ABCs that Dr. Allweiss went over. Next slide. So I think the National Diabetes Education Program is a great support for us, a great resource for us to develop, and we are developing some educational materials that we will run through the CDC and NDEP. Next slide. So at this point, I can turn it back to Cody Jones, and you can work with any questions that people might have. Thank you so much for attending today.
Thank you, Dr. Dowd and Dr. Allweiss. And as a reminder to attendees, if you have any questions, to please type them into the question queue now. We have roughly 10 minutes to do Q&A. I do have one question as of now. You spoke of smoking as being leading towards diabetes or could help increase the risk. What about chewing tobacco? Have there been any studies in regards to that?
Well, chewing tobacco, It definitely has increased problems of oral health, okay, with ulcers, inflammation, etc. Um, Smoking itself, we know, is like a double-edged sword. Is smoking a risk factor for people actually developing diabetes? People are looking at that, okay, but that's regular smoking. But with chewing tobacco, snuff, etc., it would be more of the local effects, and certainly in people who have diabetes, if they have inflammation of their gums, they're going to have and of other soft tissue areas, they're going to have more inflammation because of using chewing tobacco, etc. I don't know of any evidence that chewing tobacco itself is associated with increased blood sugars or increased incidence of diabetes, but certainly it is associated with more oral health problems, which can exacerbate what problems are already there.
Thank you. It appears that we do not have any more questions in the queue. Dr. Dowd and Dr. Alweiss, I don't know if you have anything you want to say in closing.
Well, you know, the link to some of the materials are there. The Healthy Ears Matter, we have to put it through, it's not ready for prime time yet, and we're putting it through CDC clearance, so it goes through a whole process. But as soon as it is cleared, we can, you know, stay tuned, and it'll be on that website. It probably takes about a month, 6 weeks, but at least it is on the radar screen. And, you know, CDC had done a study about hearing loss a while ago, but, you know, we have lots of different strategies and our priorities, etc. And it's great when people are kind of developing some materials, and then we can kind of, you know, look at them, etc. But it is definitely, hearing loss is an unrecognized complication, and it can be associated with so many more complications. So
And
if
I
you have
think
any
it's,
questions, please feel free to email us. Yes, Kathy, sorry.
and that's okay. I think it's very important that CDC has recognized this condition with hearing loss and balance, because audiologists, I think, have known it for many, many years, and we just assumed that everybody knew it. So reaching out and getting the stamp from CDC or from NDEP validates to the physician that this is important to look at. It is an invisible handicap. One-on-one in a patient exam room, in a quiet patient exam room, face-to-face where the person can lip read, it goes undetected and the physician doesn't see it. So this is very important to have the recognition by CDC and your support, Pam.
Well, thank you very much, Dr. Dowd and Dr. Alweiss. And as a reminder for course attendees, you will receive an email immediately following this event, which will have a link which will allow you to complete CE information and also have your assessment and evaluation. In addition, we'll also send the PDF version of the slides used today. If you have any questions for the presenters, please respond to the email from me and I'll send those on to the presenters. If you have any friends and colleagues that were unable to attend the webinar today, please let them know that it has been recorded and will be posted to the members only section of the ADA website next week. For more information about future ADA initiatives, please visit www.audiologist.org. Thank you and have a great rest of your day.